Polycystic Ovary Syndrome, or PCOS, is a common condition affecting women of reproductive age. In fact, it's the most common endocrine abnormality in this age group. There are several conditions which have similar signs and symptoms to polycystic ovary that also occur in this age group. But the primary issues that we deal with include difficulties getting pregnant and other issues caused by hormone imbalances and other metabolic problems in the PCOS syndrome. We don't fully understand the cause of polycystic ovary syndrome, but we do understand a lot of the consequences associated with this condition. There are several possible genetic factors, and currently there are many lines of investigation trying to determine exactly the underlying cause or causes. We know that consequences include fertility problems, but other health threats including high blood pressure, diabetes, and cholesterol abnormalities. A common misconception associated with the terminology polycystic ovary syndrome is that the so-called cysts are abnormal structures and are visualized as large abnormal structures on the ovaries. This is not true. In fact, the cysts are normal structures. They are ovarian follicles where eggs are contained. These are small in the 4 or 5 millimeter range. That's a quarter of an inch in diameter or less. The problem is that these follicles are not behaving normally in that they don't produce mature eggs that lead to ovulation. Our job to promote fertility is to provide stimulation to the ovaries so that a follicle or follicles will develop into a mature egg, which can then be fertilized. We frequently see patients ultimately diagnosed with polycystic ovary because of their difficulty getting pregnant. However, there are other patients who have signs and symptoms associated with polycystic ovary syndrome who are not trying to get pregnant. Some of their symptoms include irregular menstrual periods or lack of menstrual periods, excess hair on the body, especially around the face, and complexion issues such as acne. Patients with polycystic ovary syndrome frequently have problems with weight control as well. Some of the findings associated with the evaluation of these patients include high blood pressure, and laboratory testing may identify elevated blood sugars or elevated insulin levels. This is called insulin resistance and is common in this patient population. I commonly also evaluate their cholesterol profile to look at total cholesterol as well as triglycerides and HDL cholesterol or good cholesterol. When we see a patient who may have polycystic ovary syndrome, there are certain conditions which we exclude because we don't have a single simple test for the diagnosis of polycystic ovary. So the approach is to evaluate for other conditions which are much less common, and if those conditions are not present, then polycystic ovary is the diagnosis. It's important to rule out these other conditions because they may respond to a more appropriate specific treatment. Some of those other causes include thyroid disorders, elevated prolactin, other hormone disorders such as Cushing's syndrome, ovarian or adrenal gland hormone producing tumors, which are rare, and some other rare conditions of insulin resistance. So our evaluation includes history, which frequently is directed toward menstrual pattern. Many of these patients have infrequent periods or lack of periods due to lack of ovulation. This then is the basis for their difficulty conceiving. There are hormone evaluations which are helpful, which include androgen hormones such as testosterone and other endocrine tests for those specific endocrine conditions such as thyroid disorder and elevated prolactin. We also look at signs of excess androgen hormone production such as excess body hair and acne. And ultrasound of the ovaries is also part of the diagnostic criteria. The physical exam includes vital signs to evaluate blood pressure. Additional laboratory testing includes blood sugars, possibly a glucose tolerance test, and other metabolic testing to evaluate for elevated liver enzymes and cholesterol panel. Patients who are having difficulty getting pregnant, who ultimately are found to have polycystic ovary syndrome, have an underlying ovarian factor as one of their problems. We do look at other common factors of infertility, such as male factor and tubal factor, but ultimately the basis for treatment involves some kind of ovarian stimulation to produce ovulation. This might be in an IVF treatment cycle or a non-IVF treatment cycle where patients may have insemination or timed intercourse. The decision between those two types of treatment may depend on the presence of other infertility factors. Patients with polycystic ovary syndrome don't always need fertility treatment in order to conceive. The difficulty is when periods are not occurring at a regular interval, some of those cycles may be associated with ovulation, but others may not. The problem is determining which cycles are ovulatory. Over-the-counter ovulation predictor kit testing can be deceiving in these patients because of some of the underlying hormonal abnormalities. Therefore, our recommendation for ovarian stimulation is designed to give the patients their highest likelihood of pregnancy as soon as possible without trying to determine on their own if and when she's ovulating.